if we look at, for example, South Africa was the belle of the ball in the late 90s in terms of the regulations. And then in the early 2000s, we became one of the very first countries in the world to sign the Framework Convention of Tobacco Control. But since then, South Africa has pretty much done very little in terms of addressing tobacco and tobacco consumption. And in the last decade, we've seen tobacco growth, or the use of tobacco, go to points where we are long before the 2014 or even 2010 figures. We're now sitting around about a third of the South African population have used tobacco products or currently using tobacco products, including e-cigarettes. So with regards to the challenges that face consumption or reducing tobacco, is that the only thing that the state relies on is either heavy excise taxes or regulations that are just a blunt instrument to prevent, blunt instrument on the industry as well as its consumers. But we don't talk about the control, the demand reduction with regards to Article 14. So there's no cessation support, smoking cessation support in South Africa to speak of. We don't provide to our public through the public healthcare system things like NRTs or any pharmaceuticals. We don't provide them with counseling or support. And the other thing a big issue in South Africa, as you highlighted or alluded to there, is that we have an incredibly robust and growing illicit market. Currently, it's estimated around 60% of all cigarettes consumed in South Africa are illicit. And you can get, for example, a pack of 20s for as little as 12 Rand 50 for a pack of 20. Now, we also need to look at, for example, the social economic situation in South Africa. South Africa is the most unequal society in the world. So there's very, very many people who are predominantly, who are people that smoke, are in a social economic environment or situation where they would not be able to afford any kind of support. So they have to rely on something like cold turkey, just quit or die. And unfortunately, that's very unsuccessful. So I'm not under any delusion that vaping is a silver bullet in South Africa. However, this bill clearly indicates that there is no appetite for a conversation around harm reduction, because there's a whole host of other products which could perfectly suit the South African environment, like nicotine pouches. But the mindset of lawmakers and health experts is that any harm is harm, irrespective of a or spectrum of harm. If we know that cigarettes are incredibly harmful and they sit at one side of the spectrum, and we know no consumption whatsoever is on the other side, we've known for many years that things like nicotine replacement therapies all fall into that section of harm right next to no consumption at all. And e-cigarettes and nicotine pouches are more in that area. But unfortunately, the language you're getting is that any harm is still considered as harm. So the biggest challenge with aphasia is just an acceptance that we need to be more pragmatic in our approach in reducing smoking, that South Africa doesn't have the capacity to implement or enforce any of these laws. Because in 2020, when they enforced the sales ban on tobacco and vaping products as well as alcohol, we saw the illicit and black market explode. And very few people took the opportunity to quit. And then when we researched it after the ban, we noticed that many of those individuals went back to smoking anyway. So we need to be very, very mindful that, this should be consumer-centric, pragmatic, and meet people where they are at, rather than just bashing them with more regulations, more excise, and knowing full well that we have a track record that's completely failed.
Can I just add to that? This comes from a sort of like tragic conceit, really, from governments, that if they sign a bit of paper with words above it saying that you're not allowed to do this or you're not allowed to do that, that automatically eradicates the problem they're trying to eradicate. That's obviously not the case, especially when you have a product that is in much demand, like nicotine. Nicotine has been used by human beings for 12,000 years. And anyone who actually, sorry, I've got a cat on my desk here. So, anyone who thinks that you're going to eradicate nicotine use is really living in cloud cuckoo land. It's just not going to happen. So what the goal should be is, well, accept these people. So people will use nicotine. It's a drug that many people use in every country around the world. And like I said, it has a long history. So the goal should be, how can we get our public to use nicotine in the safest way possible? And the law that's being planned, the laws that are being planned in South Africa don't do that at all. They treat both exactly the same. So why would you want to place such burdens on the safer product when you know that one is much more harmful than the other?
But it's not only that. If you think about it, you know, the 2021 Global Adult Tobacco Survey, which was the first and only one that we've done in this country. So we don't even have any mechanisms to measure success or failure in the country. That's problem number one. But in that particular data set, what it was discovered was just over 30% of South African population even knew about e-cigarettes. And when we looked at the data itself, only 2.2 of the people that responded to the survey had ever used an e-cigarette. So this is really not an issue. But when we look at smoking is a significant issue in South Africa. As I've said, we're now looking at close to 30% of South African population that use tobacco products. But only 30% of them, or just over 30% of the people they surveyed, even knew about an e-cigarette. And then again, we look at individuals that can't afford these products, but it's in our infinite wisdom, we then slap an excise on these products, making it even less affordable to many South Africans that were using these products to stay off cigarettes. So again, it's just regulation, legislation, excise, but there's nothing pragmatic about addressing the situation. We can all agree that we do not want the youth to pick up cigarettes or vaping products or any other risky product. Unfortunately, they are going to, but we should put measures in place to prevent that. But we should not ignore close to 11 million South Africans that are smoking that will be facing things like cancer, heart disease, lung disease, and you name it, because all that's going to do is add more pressure and more burden on the state, which is already buckling under all the pressure.